Hi everyone, welcome back to another installment in the Nico the Vet Show series. For this talk today, I thought what the subject we might tackle would be hip dysplasia in dogs. The reason I say in dogs is, although in theory any animal, you, me, the dog, the cat, any animal at all, could get hip dysplasia, it turns out in reality in the veterinary arena, certainly in small animal practice, companion animal practice, that hip dysplasia in dogs really is the issue that we face. Now, most people have heard of hip dysplasia, and many people will often assume that it's a German Shepherd problem. And this is because German Shepherds are probably the most publicized breed with this problem, but it's not specific to German Shepherds. Any animal, like I say, can develop hip dysplasia, and any breed of dog can develop hip dysplasia, whether they're purebred or thoroughbred. But the trend tends to be that it's the larger dogs more than the smaller dogs, and within the larger dogs, it tends to be certain breeds predominating, like the German Shepherds, Bernese Mountain Dogs, Golden Retrievers, and Labradors, probably the highest sort of occurrence rate. Other breeds, even amongst the big breeds like Irish Wolfhounds, very, very low incidence rate. So what this tells us, the fact that there are trends within certain breeds, is that there has to be a genetic reason for this. So, and that's important because a lot of people think it's something they did, like they let the puppy exercise too much, or they exercised the puppy too soon, or it was running up and down stairs that caused it. And the answer is no, it's none of this. It's not your fault. It's not the dog's fault. It's their DNA. They were programmed to always have the problem of hip dysplasia. So what is it? If you break down the word, like most medical terminology, the breakdown of the word will tell you what the problem is. So hip dysplasia, hip means the obvious, means hip. Dys means wrong, plasia means to grow. So what in essence what that means in essence at least is that the hip joint per se has grown wrongly. And that results in it being an ill-fitting joint, and that in turn leads to premature wear and tear. So think of the hip as a ball and socket joint. So within your pelvic bones on either side, you've got a socket, and the hip bone, not the hip bone, the thigh bone is a straight bone going up the thigh, and then it turns through almost 90 degrees to form the head of the femur, or which is the thigh bone. So femur, thigh bone, same thing. So you get the femur coming up, then you get the neck of the femur, and then the head of the femur, which is meant to be a perfectly round, cylindrical, ball-shaped structure. That then fits in the socket joint, which is meant to also be a perfectly round structure, and these two round things then fit inside of each other, and you should have a nice tight fit, and it glides and moves like a ball and socket joint. So when you have hip dysplasia, it means one or more parts of this smooth, tight-fitting ball and socket joint are defective. So the obvious would be if you have the socket, and instead of it being a nice socket that the ball can fit into, it's a big flat, almost more of a dish than a socket. Well then, even if you have a perfectly formed femur head, it will bounce around within that space and not be contained. And you can see the effect of it bouncing up and down and backwards and forwards is it's going to start bashing onto, well, both bones are bashing. So the thigh bone, the ball part bashes on the socket part, and that damages both the ball and socket. But you can also get any variant you care to imagine. So you may have a nice round socket, but the ball part, as my sort of fist demonstrates, may be square. So now you're putting a square peg in a round hole. Again, it's ill-fitting. Again, there's this bashing effect, and that leads to damage to both of the bones. And in other cases, you may even just get a well-formed socket and a well-formed ball, which fit together very nicely, but they're loose. They're not held together very well. And that just means in the course of your normal activity, there is still a little bit of give, and the two bones bump together and bash together. Again, this is a genetic problem, so you were always programmed to have this problem, but it sometimes may not manifest in your youth. So usually, more often than not, you'll know if you've got hip dysplasia by the time you're about 3 years old. But I have seen isolated cases where and stud dogs often have been, not often, but it has happened. Stud dogs have been tested. They've had x-rays to prove that they have good joints, and these have been scored and confirmed to be so. They then go on to become stud dogs, and they sire many, many offspring. And then we find at sort of 7, 8, 9 years old, suddenly they themselves start going lame, they have painful hips. We take x-rays again and we find that they have arthritis in the hips because they had hip dysplasia, which wasn't necessarily obvious when they were youngsters, because again, everything was well formed and well fitting, but just they were designed to not wear well because of a little bit of laxity and a bit of movement in that, and so they wear terribly. Of course, this is a disaster because these dogs, by the time we identify this, will already have sired many puppies who, again, because it's genetic, will have inherited this from their father. But let's rewind a little bit. So if you are born and you are programmed to have hip dysplasia, again, no amount of exercise modulation or dietary modulation will really have a significant impact on that. People often worry, if he ran up and down stairs, maybe it's my fault that my pup now has hip dysplasia. And I would put it like this. I would say, if you are genetically programmed to have good hips, no amount of running and jumping and leaping and tearing about is going to change your DNA and give you bad hips. And conversely, if you are programmed to have bad hips, no amount of exercise restriction or dietary manipulation is going to change your DNA and suddenly give you good hips. So it's preordained. What will be will be. So let's say one has hip dysplasia. What are we likely to see? So usually in the early part of that individual's life, it's often less than one that we start to notice the problem, but certainly within the first 2 to maybe 3 years, we'll notice just subtle things at first, and they're easily explained if you understand the mechanism. So the mechanism is, again, you have an ill-fitting ball and socket joint, there's a bit of bouncing and bashing, and the bashing causes pain. So pain is a disincentive. Pain is nature's way of saying, don't do that. And so with these individuals in the early stages, often you won't notice a lameness per se, but you'll notice they walk awkwardly. They've got sort of a sashaying, a wobbly hip gait. That can often be the first sign that they're uncomfortable. And think of it as every time they step on one side, they think, well, that's sore, I'll change my weight to the other. Oh, no, that's sore, and I'll get off that one. And they keep trying to get off it. So they get this funny sort of sashaying supermodel sort of gait as they walk along. And then as that progresses, the next sign that you would see is that individual, despite being a young, boisterous, happy puppy, will become less and less inclined to take a lot of exercise. They will prefer to lie down a little bit. They'll still engage with you and look up at you and wag the tail and very happy, but you'll see they'll have a disinclination to want to get up and leap around. And that's what puppies do. That's a normal thing. So if you notice your puppy's just not engaging, it doesn't want to get up, it doesn't want to tear around, doesn't want to play fetch. Well, some breeds don't care. My wolfhound, if you throw the ball, she'll go, well, you threw it, you get it yourself. So you have to sort of measure what's normal for the personality of your individual dog, but equally, it's normal for puppies to be lunatics. So if your puppy is not, that can be another early warning sign that the reason they're not tearing around is they want to, but it's sore, it hurts them, so they choose not to. And then as the condition progresses, because obviously they must move around to live some sort of a life, that wear and tear in the ill-fitting joint will progress. In the same way that if any ill-fitting joint will show premature wear and tear. So if you have a door hinge, for example, that's not well fitted or not well aligned, and the opening and closing of that door will lead to premature wear and tear, and that door hinge will wear out before it should have done. So, and bearing in mind any mechanical moving part rubbing within another part, so whether it be your hip joint or any other joint or any other hinge or your car or whatever, any mechanical moving part will wear out. But with hip dysplasia, you wear that much quicker because there's the ill-fitting joint and the grating and the grinding and the chafing that leads to premature damage then that induces premature osteoarthritis and pain. And now the consequences of this wear and tear are multiple. So if you imagine, go back to the model of the ball and the socket joint. If you look at the actual bone, the thigh bone, the femur, you've got the bone making the ball part. Around the bone is the joint cartilage, which is really, really super smooth, a shiny lining which covers the bone, and that has multiple purposes. One is it's smooth and it's slippery, so it's designed to glide against the joint cartilage of the other bone forming the joint. Also, think of it as covering all the nerve endings in the bone. So as you get the bone grating and grinding and rubbing and chafing, you grind away that layer of cartilage, covering the ends of the bone, making the joint. And that does several things. Now you no longer have a smooth surface, so now it wants to tend to catch and drag and snag. And also you've exposed the nerve endings in the bone, so when you do catch and snag, it's super painful because you're hitting directly onto these nerve endings. So this will progress and progress and progress until eventually you have no joint cartilage left and it's really just bone on bone. Why is this relevant? Well, let's think about what we can do for these individuals. So in the early stages of the wear and tear going on, if we catch these puppies very, very young, I mean definitely less than 6 months old, and ideally significantly less than 6 months old, there is an operation that one can do to tilt the cup. So imagine the socket at least. So imagine the socket and the ball again. If the socket is just too shallow, they can do an operation, so it's not really fitting, it's not really containing it. They can do an operation where they tilt the socket, they as in orthopedic surgeons, and that tilts the socket, and now as you weight bearing like this, because it was like that where you want to sort of slip out of it, they've tilted it, and now it gives you greater and better coverage, and it's still ill-fitting, but it's less ill-fitting than it was. So that's an option with very, very young dogs, less than 5, 6, 7 months old. If you catch it early, then you could do this corrective osteotomy, which is cutting the bone and resetting it. But mostly that doesn't happen because most of us don't realize what's going on until the dog is older. So now as vets, we're presented with a relatively young dog who doesn't want to run around and has obvious pain and is nowhere, can't live a full life. They're not as full and active as they should be. So stage one, and you sort of stage up the level of intervention and care that we provide for these patients according to the stage of the problem that they're in. So in the very, very early stages, we might go for what I would call entrance level drugs. And this would include things like glucosamine and chondroitin sulfate. They've been very popular for years, but increasingly I'm beginning to question the value of it. The idea behind glucosamine and chondroitin sulfate is think of them as like a WD-40 oil or a lubricating oil in the joint. And if you've got this sort of wear and tear and grinding, if you just put more joint in it, more oil in the joint, it just moves better and will wear better. In the same way, if the door hinge on your door isn't working well and it's a bit squiff and it's a bit creaky and squeaky, if you oil it, it will work better. Not forever, but it will work better than it would have done if you'd not oiled it. So in the early stages, glucosamine, chondroitin sulfate, we can try those. There are a product that has been shown to work, which is a nutraceutical or a sort of a more natural product, is green-lipped mussel, which is moule de mariner, pardon the French accent. It's what people eat, mussels that people would eat in restaurants. I think they're a disgusting concept. I don't know why people would do that, but people do. And these are particularly ones with green lips. I think they farm traditionally off New Zealand. They've been shown scientifically in studies, human studies, mind you, but believable studies, and I think we can extrapolate the results into dogs. They've been shown to have an anti-inflammatory effect. So in the very, very early stages of your pain, when your pain is still low-level pain, green-lip mussel extract would be absolutely appropriate for your dog. You can get that at any health shop or on the internet, and it's literally just that ground-up, dried-out green-lip mussels put into capsules. So that and the glucosamine, chondroitin sulfates are an option. People are often experiment with other products which are sort of a little bit faddish. They come and go. To my mind, none of them make a particular difference. So I'd leave it there in terms of treating the initial stages. And as things get worse, which they inevitably will, again, it's not your fault or the dog's fault, it was programmed to happen. I would think another treatment that one can step up to is pentosan polysulfate, which is commercially marketed as traditionally as Cartrofen, but there are Synovan and Pentosan or variations on it. I'm not advertising for anyone. I'm just throwing those names out there because that's the name of the product. So these products are maybe a little bit contentious. What they claim to do is that they help the joint cartilage to regenerate and repair itself. And remember, that's what's grinding. They also help the joint to increase the lubrication, the oil. So that also makes perfect sense. And they do seem to have a mild anti-inflammatory effect. So on paper, that's just like the perfect drug. It's just you know, why would you use anything else? In reality, I think I'm frustrated by the drug. It's a little bit hit and miss. It indisputably works for some individuals, but it's not predictable and reliable in all individuals. So I think it's worth trying, and think of it again as you've got this joint wearing out. So this will address the grating and the grinding. It will patch up all the damage that's been done and have some anti-inflammatory effect. If it works for your dog, great. It's a series often of 4 injections once a week. So you have a jab once a week for 4 in a row. It's not in the joint, it's just under the skin. Your vet will do it for you. And that will often, the benefit of that will last for as much as a year. Some dogs will need top up sooner. So in principle, it's a lovely drug. I wish it worked better than it did. It certainly works for some. So I think it's worth trying. But again, in the beginning stages. But we will reach a point where where what you're doing so far, so the green lip muscle and all these injections we've spoken about, are no longer enough, and your dog has shown an improvement, which is why you continued with them. So they're more active, they're running around, they're jumping, they're doing dog things, but you suddenly see they're sitting down more again. They're reluctant to join in the party, and they're reluctant to go for walks, and they often seem to be more sore on the walk. So rather than just the sashaying gait, you actually see your dog limping now, and they sort of, how do you limp? Well, just look at any human being limping. It hurts, so you're constantly trying to get your weight off. And the way nature is, nothing is symmetrical, so nothing is the same on both sides. So although you may have hip dysplasia just on one side or just on the other side, and even if you have it on both, often one side will be worse than the other. So when you get to the stage where you're actively limping and these entrance level medications aren't working, well, then you're entering the realm of what are called the non-steroidal anti-inflammatory drugs. In essence, what these do are these are painkillers and anti-inflammatories. And literally, you're going to commit to these, and you're going to take them once a day for the rest of your life. Some people say, well, can't I use it tactically? I'll use it only when my dog seems to be sore. The answer is no. Studies have shown, again, there were studies done in human beings, but we can extrapolate. Studies have shown that if you have a significant joint pain or joint problem, there's no point treating it, well, there is some point in treating it tactically, but it works much better if, rather than treating tactically, which is to say just when you think you're sore or you need it, treat every day, irrespective. Just take it every day, and actually it works an awful lot better. You get a better effect in the short and the medium and in the long term. So once one commits to these non-steroidal anti-inflammatory drugs, they'll often give you the dog great relief, and you'll see them very, very comfortable, much improved. And human beings who have got hip problems will tell you exactly the same. Some people, I'm always surprised when they say, well, I don't want to use those drugs because they're not actually curing the problem. They're just covering over the problem. They're just masking the symptoms. Well, my answer to that is, yeah, exactly. That's the whole point. Because the only alternative to masking the symptoms, so the wear and tear continues irrespective of what you do, but let's make you more comfortable while that happens. So if you don't want to take this approach of masking the symptoms, well, then you've got to stop the wear and tear. And the only real proven way of, well, you can't stop the wear and tear, but address the wear and tear, is to go for a hip replacement. So hip replacement was pioneered in human beings. It was a bit clunky when it first was developed, I think over 100 years ago. Same deal in dogs. It was a little bit clunky while the surgeons were getting the hang of it, but they're very good at it now. So if your dog needs the painkillers and you don't want to do the painkillers for reasons of your own, then the next recourse is think about hip replacement. I would always say in dogs, just like in human beings, stage up your medications. So you start with something like green lip muscle, then you go up to the cartrophin, the pentosan polysulfate treatments, then you go up to the non-steroidal anti-inflammatories, and try, as long as they're working and as long as they're giving you a pain-free, comfortable quality of life, absolutely go with that until they no longer do that, and then you potentially are looking at hip replacement. And you need to sort of gauge this with your vet, because there's no point having your dog just coping on the anti-inflammatories, because then really they are a candidate for hip replacement if that's on the menu in terms of your philosophy and your budget. So it's not about letting the dog get to absolutely hobbling, incapable of doing anything stage. It's just when you feel that they're not able to do what a dog their age and breed should be doing on all the medications, then think about hip replacement. If the problem with hip replacement, the pros and cons, the pros are it's beautiful, it works really well. Cons are, yes, there are complications like any surgery, and a small minority of them may go wrong, and they can go catastrophically wrong. But that's true for any bone surgery, so that wouldn't necessarily put me off. Probably the biggest disincentive is the cost. It's very, very expensive. Costs do vary quite a lot, but it's not a cheap option. Having said that, if your dog is debilitated and they're sort of 2 years old, if you work out what you would have spent in medications to treat the dog and compare that to the cost of the hip replacement, often the hip replacement is a cheaper long-term solution to the problem. Something else that's also gained a little bit of traction, and it's not quite there yet, but the principle is nice, is stem cell therapy. So if we go back to, this is what one might consider at any point along the journey before you get to hip replacement, is we can harvest, often it's fat cells from the dog's own sort of belly area, and we harvest the stem cells. Remember, stem cells are cells that haven't decided what they're going to be yet, and we can influence what they decide to be. So we harvest the stem cells and we inject them into the joint, and we ask them to become cartilage joints. So think of the grating, grinding bone inside as having sort of grazes and scrapes and erosions on it where the cartilage is being rubbed off, and compare that to, say, your lawn, it may have bald patches on it, and you want to go outside and sprinkle some grass seed on there and some fertilizer and grow new lawn, or get the old lawn to grow back in and cover up the bald patches. Well, your joints are just the same. So the principle of the stem cells is if we can put stem cells in there and tell them to become cartilage cells, if they can grow and develop and patch the problem faster than the wear and tear happens, well, then you don't need the hip replacement. So it's an elegant solution to the problem, but the technology just doesn't seem to be there yet. Hopefully that will come. It's a tall order to ask some repair process to outstrip the damaging process, but it would be a great alternative to the hip replacement treatment. So to sum up, hip dysplasia is genetic. It's not your fault. It's not the dog's fault. It's not that they got too much or too little or the wrong exercise. They were always programmed to do that. The trick is identify the problem quickly, address it quickly. Why? Because you want to give this dog the maximum quality of life you possibly can, and keep modifying. Remember, it's not carved in stone. We keep jigging. We keep moving around the doses. Even before necessarily we take the plunge from medication to the hip replacement surgery, we will often start piggybacking drugs and doing drug combinations. We'll often introduce 2 human drugs. One's called amantadine, one's called gabapentin. They're not licensed for use in dogs, but we've learned over the years that we can piggyback them with the conventional non-steroidals. In the non-steroidal family, you would get well-known drugs like Metacam or Rimadyl or Previcox or Onzior. They're much of a muchness. Often vets will have different preferences and people will have different opinions, but they pretty much fit in the same family of drugs. And you can piggyback those onto the human medications, but you need to do it with your vet to make sure you don't do any harm. And that's really the situation for each individual. And again, we really must be treating and helping these guys. Dogs lead, depending on the breed, anything from 10 to 15 years old, at 15 years, and it's not a long time. And I think it's very, very important for them to get the maximum quality of life they can. So that's, like I say, the management of the individual. If we take a step back and look at the bigger picture, we would say that, okay, this is a genetic condition, so it's being transmitted from the parents to their offspring, to their offspring, to their offspring. So what can we do to try to prevent this problem? Because as always, prevention is better than cure. And the answer is selective breeding. So let's try and identify those individuals who have good hips and those individuals have bad, and only breed with those with the good hips. So what constitutes a good hip? In the UK, the system that we've been using, which in principle makes a lot of sense, is every dog who has who's intended for breeding will ideally have their hips x-rayed. We have to knock them out for it. We have them on the back. We take them in an extended leg position. We take an x-ray of the legs. We send it off to an independent panel, so there's no bias with them. They don't know anything about the dog, and effectively they will just pick holes. They'll say, well, here's a problem, this is a bad problem, this is a little problem, and they assign penalty points for each problem, and then you top the whole lot up. And the maximum you could have is 106 points, which is an absolute train smash of a joint. But most dogs are ending up sort of in a double digits number, something in the teens or the 20s or the 30s. And then the thing to do is the BSAVA, which has been collating all these hip scores, they will have the hip scores from literally thousands of animals within that breed, so they can give you an average score for that breed, and it will be different. So I think the average hip score for a Labrador is in the mid-teens, whereas for a dog like a Bulldog is pretty high. I think Bassets may even be sort of in the 30s, which is normal for their breed. And that means if you want to breed with your dog, or you want to buy a dog and you want to look at the breeder's dogs, you want their hip scores to be better than the average for their breed, because it makes sense. If we only ever breed with the animals whose hip scores are better than the average for their breed, then the average score will come down and down and down, because we're only breeding with the ones who are better. If we're breeding with those who have scores at the breed average or a little bit over, that's no good, because we're breeding the bad genes back in, if you like. So we should be selecting for those with better than the average score for their breed and breeding with them. And if we do that again and again and again over time, in principle at least, we should improve the breed. This has met with some disappointment, this system, because although it makes great sense in principle. In reality, like I say, there are some dogs who will look good on the initial X-rays as youngsters, but they just wear terribly. So there's a further complication to hip dysplasia. It's not simply ill-fitting; it's sometimes just ill-wearing. So they just don't wear well. And by the time we identify those individuals, unfortunately, they've already bred. So I suppose the perfect scenario would be collect semen from all the male dogs that you want to breed with, monitor them throughout their lives, and once they've passed away from old age, and we've monitored how they've progressed, we can thaw their semen and artificially inseminate the girls and create much improved puppies, because we'll have that sort of retrospective information. They very much do that sort of thing in cattle breeding, where you can buy a book and see all the good and bad traits of the bull. So we're not there in dogs, and I'm not sure we ever will get there in dogs, but it shows you there is a way of improving it. And the idea is, if we can just selectively breed from the best individuals every time, and we do this sensibly and responsibly, then we should benefit the breed, but also the families, because there's terrific heartache that comes with buying this bundle of joy, and you take it home and you love them terribly, and then they just get older and older, and they end up with terrible hips, and they end up in pain. That has happened with me. I just I adopted a little puppy once, just no one else wanted her, so I took her. She was a wonderful, delightful creature, but after a few short years, she developed the hip dysplasia, and there was just this agony of watching her condition progress and me constantly chasing and helping with the problem. It's just heartache. So if we can prevent the heartache to pet owners, and also the trauma and the discomfort to individuals, I think it's a worthy cause. On a lighter side, it always strikes me as odd that in the veterinary world we're always picking the best of the bunch to try and breed with, to try to improve the breed and improve the species. And in human beings, we just very laissez-faire. Anyone breed with anyone. There's no checks. There's nothing at all. Off we go, and you just see what you get. And that's maybe why, as a species, we are arguably getting weaker than if we'd allowed more natural selection. But that's a debate for another day. So the bottom line is, it is an issue. It can affect any breed, and there's a lot we can do about it. And really, there's a lot we should do about it. It's not fair to leave these guys hobbling. And one of the counter arguments I've heard is like, they say, well, he's sitting around doing nothing, therefore it's okay. He's just got a more sedentary life. The answer is no. It's not as simple as that, because even just sitting there doing nothing, that individual is still in pain, and that will just disrupt their quality of life, but even their sleep. So you know yourself, if you've ever had a sore joint, sleeping is tricky. It's painful every time you move around. So you get these chronically sleep-deprived dogs. That makes them even more grumpy. The pain makes them grumpy. They don't want to play with other dogs, because as other dogs approach them with all the bustle and the enthusiasm, they sort of get a little bit aggressive and warn them off, because what they're actually saying is, I'm just too blooming sore to play with you, and please don't barge me around, please don't knock me around. I'm really, really sore, and I'd much rather just warn you off and not have it. And that's less than ideal for any individual's life. So hopefully that all made sense. We're globally, all of us, in the midst of this wretched COVID situation. So I wish you all well. I wish you all good health. And keep your questions coming. Thank you very much. And the positive comments. And I'll see what we come up with. If anyone has any requests of what they'd like me to ramble on about, please send it to me on my YouTube channel, Nico the Vet. And I'll hopefully address the questions for you then. Thank you, and keep well. Bye-bye.